Hello, my name is Cody Wallace. This is going to be a pathogen project presentation for Epstein-Barr. Epstein-Barr virus, also known as human herpes virus 4, part of the herpes virus genus. This virus was discovered in 1964 by Anthony Epstein and Yvonne Barr, followed by its classification of the herpes virus family group uh, into the genus by the International Committee of Taxonomy of Viruses in 1971. Um, this virus is able to infect any persons of any age. It can infect babies, children, teenagers, and adults into their elderly stage. Um, for this contraction of disease, um, it is transmitted by bodily fluids such as saliva, blood, and semen. Typical life cycle of the Epstein-Barr virus. If you're in a younger age, anywhere from 5 years old to early adulthood of 24 years old is the most likely that you'll be able to contract the virus as far as exposure. This virus has a 98% exposure rate to the human population. With this virus can last anywhere from a couple of weeks to several months in the human body as far as how long the signs and symptoms last for. A distinguishing feature of EBV and other herpes viruses is the existence of a true life cycle of latency and lysis. During the incubation period, EBV DNA is presented in the nucleus of infected cells, expressing only small amounts of latent proteins. Induction from latency to lysis is called reactivation. The most um, likely point of entry for the EBV is going to be the mouth. Any cuts in the gums, tongue, cheek, the tonsils, even the upper pharynx and the nasopharynx there where your sinus connects through your palate to your mouth, would be a more viable option for the EBV to be able to enter the body. Route of transmission, other means for entry for the virus. We talked about saliva for the mouth. That can enter that way. For blood and semen, this means that you can have the virus transmitted through intercourse, receiving blood transfusions, or even also receiving organ transplantation. Um, Also, any inanimate object that could be placed around the mouth or lips after having a bodily fluid on it. So if there was blood, semen, or saliva on an inanimate object, um, having touched that and then touching your mouth, or having that inanimate object touch your mouth, more susceptible to contracting the virus. This virus affects two main systems of organs in the body. The first system is going to be the nervous system. Nervous system is going to include brain, spine, and nerves. This is also going to include other conditions where once you contract EBV, other conditions may follow for um, like not as a side effect, but what also another condition that you can get from having this, such as viral meningitis, transverse myelitis, Guillain-Barré syndrome, which are shown on the pictures there. For Guillain-Barré, it basically deteriorates the nerves; they just fray. You start losing motor functions, if not having some like twitches. Transverse myelitis is just inflammation in the spine, and meningitis will be inflammation inside the brain for the meninges, the layer between the skull and the brain. For the hematol hematological system, um, EBV can infect the person's blood and then eventually move into the bone marrow of a person. This particular situation where they go into the bone marrow creates a high white cell count, um, but only if it reaches that point. If it is only in the blood, then it doesn't show as high of a white blood cell count. But this can also weaken the body's immune system. Any other conditions that follow in the hematological system could be hemophagocytic syndrome, acquired hypogammaglobulinemia, and X-linked lymphoproliferative lymphoproliferative disease. For Epstein-Barr, for morbidity and mortality, the National Library of Medicine estimates that 265,000 incident cases, along with 164,000 deaths, were due to the EBV uh, from says from the increase was from 1990, but the years were from 1996 until 2017. That was the current stats. With this increase of 36% in incidence, 19% increase in mortality from 1990 and in 2017, EBV attributed malignancies caused 4.604 million DALYs, of which 82% were due to NPC or GC alone. Some of the signs and symptoms for EBV, you're going to have fatigue, fever, an inflamed throat, swollen lymph nodes, an enlarged spleen, a swollen liver, a rash, some other symptoms that could also be associated with contracting mono or mononucleosis will be having chills, other aches, nausea, some vomiting, as well as loss of appetite. Treatment for Epstein-Barr virus, um, they are similar. So the Epstein-Barr virus, the symptoms are typically like a common cold. At the worst end of it, it will be like the flu. Um, these don't usually warrant going to a hospital. These are usually symptoms where you would assume you have the flu and then take an Advil and leave something, pain medication or a fever controlling medication. If those symptoms last for more than a week, then it becomes a little more serious. You want to go to a hospital and check that out as soon as possible. According to Stephanie Thurett from Banner Health, unfortunately, there is no cure for the Epstein-Barr virus infection and no medications that treat the infection itself. Main way to address this virus is just try and get rest, try and get as much sleep as you can, stay home, drink water, and take any medication for relieving that pain or bringing down a fever. Some other additional treatments and modalities, um, because of mono being contracted with that as well, some people need to treat the mono as well. So some people will use throat lozenges, but currently today, um, some people need treatment for other health problems caused by that mono, but most people with the disease get better within a month, says Pritish K. Tosh, MD of Mayo Clinic. There is no current therapeutic or surgical means of treating Epstein-Barr virus as well. And then for references, we have Create Diagnostics, National Library of Medicine, Centers of Disease and Control, Centers for Disease Control and Prevention. Stephanie Thurrott, who wrote an article in Banner Health, and Pritish K. Tosh, MD, who wrote an article for Mayo Clinic. And that is all for my presentation.